Okay, guys, welcome. Whew. All right, we're gonna go ahead and test the sound here. Do you guys hear me loud and clear? Testing 1, 2, 3. Testing, testing 1, 2, 3. All set? Perfect. Good afternoon, everyone, and welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator for today's class. Here at Lotus Institute of Integrative Medicine, we have been holding educational seminars and webinars for over a decade now. And it's been such a wonderful journey filled with many experiences and lessons taught by speakers who are not only experts in their respected fields, but more importantly, they're willing to share their wealth of knowledge with all of us. We believe that the future of TCM and the advancement of Chinese medicine can only be obtained through continued growth, learning, and progress. And that's our goal here at eLotus. And one of the ways that we are able to help you in your profession is through our live CEU webinars. These webinars are on the weekends and usually for 8 CEUs a day. And if you're not able to make it to the live webinars, we do record them and archive them as distant learning online CEU courses. We have videos, audios, and articles. Okay, so today's class is a preview of Dean's full day workshop, which will be this Sunday. It's a webinar, so you can watch it online, and we do have a few seats available also if you want to go ahead and come in person as well. The class will be from 9 a.m. to 6 p.m. We'll have a 1-hour lunch break from 1 to 2 p.m. So make sure you have all your bloodletting needles ready to go because you're going to be learning so much on Sunday. So today's class is an intro to Tung-style Bloodletting for Real Relief with Dean Mouscher. And Dean graduated from the Midwest College of Oriental Medicine. After learning that Master Tung bled 40 to 50% of his patients, he devoted himself to study and practice of this ancient art and was amazed at how quickly bloodletting was able to resolve stubborn cases that no other therapy has been able to touch. For the past several years, Dean has specialized in Master Tung-style bloodletting, studying it extensively and bleeding more than half the 80 patients he sees every week at his busy Chicagoland clinic, gaining vast experience and expertise in this nearly lost, unfathomable, powerful healing art. And lucky for us, he's here to teach us about it today. So let's go ahead and give him a big warm welcome.
Hello, hello. Can you hear me? Okay. Is the video working?
Oh, no, the video is not working.
Oh, okay.
Sam says to stop and reshare.
Okay. So, let me try it again.
Close what?
It was working just a moment ago.
Dean, Sam says to go ahead and close your window and log back in.
Okay.
Okay. All right, thank you guys for waiting as we get Dean back on here. Just to see how many of you guys, this is your first bloodletting course. Type in first into the chat room. Okay, great. Looks like we have a lot of first timers. You guys are actually in for a treat. And before meeting Dean, I actually read that Master Tung, he used bloodletting for chronic issues. That's his go-to thing. Oh yes, Margaret, I am off camera actually right now. Stan paused the picture of me. So as we wait for Dean, you guys can see me sitting there. I'm not moving though, so don't worry about that. Okay, how many of you guys, this is your first class with Dean, learning from Dean? Type in Dean. Okay, wonderful. So we tried something new with our to increase to get this webinar known to you. So how many of you registered through email? Type in email. Wow, awesome. Sound is off? Okay, Steve, sound is good. Welcome back.
Are we on? Okay. Very good. All right, shall I get started? Donna? Okay.
Yes.
All right. Just can you tell me? Okay, very good. All right. So welcome to the webinar on Master Tung Bloodletting. So the main thing that I want to communicate today is how magical bleeding is. A lot of people think of Master Tung as the greatest acupuncturist of modern times. Certainly, everybody agrees he was one of the greats, and he bled some 30 to 40% of his patients. So everybody knows that Master Tung produced incredible results, but it's very important to realize he didn't do it with acupuncture alone. Sometimes people think, well, if I'm not getting results with Dr. Tan or Master Tung, it's because I'm not finding the right points to needle. But Master Tung himself didn't rely on acupuncture alone. To the contrary, his 30 to 40% of the time he bled, and that included his most difficult cases. So without bleeding, Master Tung would never have attained those incredible results. All right, and the reason I like bloodletting so much is that it's an easy way to produce miracles. It's actually pretty easy to do. We'll be talking about that today. And for so many difficult conditions, nothing else can break through and do the job as well. So some very difficult things like endometriosis, interstitial cystitis, migraines, sciatica, nausea, trigeminal neuralgia, some of these very, very stubborn and difficult conditions that nothing else can touch. Sometimes when you bleed, you get instant results and very powerful results. And one of the main things I want to get across is I think there's this idea out there that bloodletting is scary, and it's this macho, scary, edgy modality. Maybe part of that is because it's not taught much in schools, or maybe that's the reason it's not taught much in schools. But I think the problem is that it just hasn't been modernized and refined. And it turns out that if you use modern tools and if you use modern techniques, which are all readily available, bloodletting is very practical. It's very easy to do. And so I'd like everybody to get comfortable with it, because if you're not comfortable and confident, you won't do it. Your patients won't be comfortable. But it turns out it's really very easy to get set up and start bloodletting. It's so underused. And another thing is, you don't need a lot of blood. I think people think they have this image that you set a patient in a bathtub and fill the bathtub with their blood, and that's what you have to do in order for it to be effective, and that's not true. Um, all you need is very little blood, and I'm going to be showing you a video later today and several videos on Sunday, showing you how gently and superficially you can bleed and how effective it can be with just a very small amount of blood. Not only does bloodletting relieve pain, it has systemic effects too. Even Western clinical research has shown that it dramatically reduces the probability of heart attacks. It can regulate body temperature, activate the immune system, reduce inflammation, and a lot more. So I want you to take a look at this study that was done in Finland and printed in the American Journal of Epidemiology. And it shows how donation of blood is associated with reduced risk of myocardial infarction or heart attack. And just look here where it's at the circled text. The study basically eventually enrolled 2,862 men aged 42 to 60, followed them for an average of 9 years. I think the study was going on 11 years altogether. And there were two groups. There was the group of men who did not donate blood. There was a group of men who donated blood, and they didn't have to donate blood very often. In order to be in the donor group, they only had to have donated blood once in the 2 years prior to the beginning of the study. Despite that, out of 153 men in the blood donor group, only one, which is less than 1%, 0.7%, suffered a heart attack. Of the men in the non-blood donor group, 12.5% suffered a heart attack. So just compare that 0.7% compared to 12.5% just for donating blood occasionally. I think you can see that that result blows away the protective effect of statins or really anything else that I'm aware of. All right, so let's get right into the heart of the matter. The three main areas to bleed for Master Tung bloodletting, and we'll talk about each of them individually, is the ears, the legs, and the back. Okay, so let's start with bleeding ears. Bleeding ears is so easy, it is so safe, it is so acceptable to patients, it is so painless, and it is so effective that if there's any possibility of it helping, it's a no-brainer. I would just do it. And it has, it can be good for two things. One, of course, is it may work. It may help relieve the patient's symptoms. And it's also diagnostic. It can help tell you if the patient has blood stasis. If the patient has immediate improvement, then you can assume that the patient is a blood stasis case and you can proceed accordingly. It is extremely powerful for anxiety, stress, depression, insomnia. And so many of my patients who suffer from these things, I will bleed them, their ear apex at every session. And as soon as I do it, and some of them, demand it. They love that release they get, and they tell me that they get an instant release when I bleed their ear. So some of these patients, if they come once a week or even twice a week, I'll bleed them at every visit. In that case, I move around the prick so that it doesn't, so that I'm not pricking at the same point. It is, everybody talks about bleeding ear apex, but it doesn't really have to be the apex. When you're bleeding the ear, there's no particular point that's important. Ear apex is good, but if you bleed a little anterior to the ear apex, that's fine. If you bleed a little posterior to the ear apex, that's fine too. It doesn't really seem to matter. You don't have to be very precise. So if they're coming often, at one appointment, I may bleed their right ear apex. At the second appointment, their left ear apex. The third appointment's their right ear posterior to the apex. The fourth appointment, their left ear posterior to the apex. And I keep moving it around, so I'm never pricking the same point, but it always seems to have the same effect. All right. And with headache, there aren't many headache patients who come in that I don't bleed their ear apex at the first appointment. It's very important because it tells me right away if this is a blood stasis case or not. So whenever I bleed the ear, I always get a baseline first. I always ask, okay, pay attention to how strong, what is your headache right now? Between a 0 and a 10. Well, it's a 7. Okay, so get a good sense of what your headache feels like right now, because I'm going to, I explain what I'm going to do. I say I'm just going to take a lancet, a diabetic lancet, like the one that diabetics use to prick their finger. I'm just going to prick the top of your ear and see if I can squeeze out a drop of blood. Sometimes that can take pressure off and make a big difference, but it'll be very interesting to me and very useful to me to see if it works on you. So pay close attention and tell me if there's any change. They say, okay. And then I poke them. And if there's a change, they'll know it. If they say, maybe, but not much, to me that's a no. If it's a blood stasis headache, they'll know, and they'll say, and they'll be surprised. They'll say, yeah, actually it's a lot lighter. Wow, how did that work? It's also very powerful for trigeminal neuralgia. I mentioned that. We'll talk about that. Trigeminal neuralgia, you probably know, is a very, very painful inflammation of the, or irritation, inflammation of the trigeminal nerve. Very stubborn. Western medicine doesn't have much for it, other than, they do pretty strong stuff. Radiotherapy, like radiation, strong radiation to destroy the nerve, or sometimes neurosurgery. And sometimes just bleeding that ear apex is a miracle. I have a patient, she was in just yesterday, actually. And she's in the book. She's one of the cases in the book, and she's been coming in for years, and sometimes I won't see her for months, and sometimes it'll flare up and I'll see her a few times, and then I don't see her for a while, but it's keeping it under control for her, and it's keeping her out of the operating room. Bleeding ears is also good for pretty much any eye problems. I've used it successfully for optic neuritis. Optic neuritis, as you may know. Margaret, I see you asked how many drops. Usually I will squeeze and wipe, squeeze and wipe, squeeze and wipe. And if I can squeeze and wipe, even 5 times is probably enough. A lot of it depends on how much time I have. 10 good drops is great. It varies a lot. Some people, the blood will come out pretty freely. Some people, you have to squeeze and wipe. Some people are big fans of massaging the ear before you prick it in order to get the blood flowing. I don't do that. It's fine to do it, but just because of time, I'm usually in a hurry. I find that if you just poke it, you might not get a lot right away, but as you squeeze gently, it'll start flowing. All right, so optic neuritis. So as you may know, MS patients are prone to getting optic neuritis, which is a inflammation of the optic nerve. And there's not much that medicine can do for it other than give steroids. And I have a patient who came in, she had MS, she came in for optic neuritis. It really affected her vision. And I bled, the worst, it was in both eyes, but the right eye was worse. I bled it, and immediately I said, do you notice any difference? And she said, well, yeah, wow, that's weird. The color saturation is so much better. So somehow this affects the color saturation, and after 3 or 4 times she was fine, and I haven't seen her in a long time. Her mother came in recently, and I asked how she's doing, and she said she's doing great. Ptosis is drooping of the eyelid. I have an elderly woman who has that, and it's a problem for her, and her doctor wants to operate. That's really all that Western medicine has for it, and it affects her driving. And every time she comes in, it's her left eye, and every time she comes in, I'll bleed her ear, and it makes a big difference. And it doesn't last forever. It'll last a week or two, but she doesn't want to get an operation, so she'd rather keep coming back to me. And so far, again, we've kept her out of the operating room. Okay, let's see. Works okay for facial palsy. Sometimes it does, sometimes it doesn't. It's certainly worth trying. Any other vision problems? Cataract, glaucoma? Probably not cataract. Glaucoma, I'm interested. I haven't had a glaucoma patient that I could try it with, but I think it might work. I'd be really interested in trying it. Let's see. Same side, same side. Yes, yes, yes. Okay. Bleeding, always same side, always ipsilateral, period, period, period. So we know that in Dr. Tan acupuncture and Master Tung acupuncture, frequently needling is the opposite side, but bloodletting is always same side, always ipsilateral. I don't even know of any exceptions. Just assume it's always the same side, period. That's all you need to know about that. Macular degeneration, I don't know. I haven't had any experience with that. What is the time frame? How long has a delay been held with repetitive treatment that doesn't last? It depends. It depends on the person. For a problem that is not unilateral, do you bleed both sides? Yes. If you have ptosis in both sides, you bleed both sides. If you have a headache on both sides, you bleed both sides. Yeah, both sides. For auricular needling or seeding is also on the same side. That's true. But in bleeding, it's always on the same side, period. Whether you're bleeding the back or the leg or the ear, same side, always. Okay. So sometimes there's spasming of muscles around the eye and around the forehead. I've had very good results with bloodletting for that, bloodletting the ear for that. Styes and conjunctivitis. Bloodletting works very, very, very well. Ear problems can also work very well. And upper limb problems too. If a patient comes in with what they think is carpal tunnel syndrome, I will not let the first appointment go by without bleeding their ear, because I need to know, is this a blood stasis case? It's not a problem if I bleed their ear and they don't respond. That's fine. You know, it's like a simple test I've performed, and I've ruled out blood stasis now. I can go on to something else. But if they have shoulder pain, arm pain, tingling, numbness, any kind of nerve pain, bloodletting seems to work really well. So post-mastectomy syndrome, it works particularly well for. Women come in after their mastectomy, and they have, one is from the surgery itself, pain and discomfort on the chest, and then also they've had lymph nodes removed from the axillary lymph nodes from their armpit, and this is very effective for that as well. If I were able to do a clinical trial, I would love to do a clinical trial of simply bleeding the ear for lymphedema. I suspect it might work very well. I haven't had the opportunity to try it much. Frozen shoulder. Frozen shoulder, it can work very well. Another place to bleed for frozen shoulder is the vein in the crook of the elbow at lung 5. And also sometimes wet cup, right there on the shoulder where it's most tender. When you bleed directly, you're looking for the spot that is most tender. So for post-mastectomy syndrome, it works very well, like incredibly well. So always do it for post-mastectomy syndrome. And still the apex. Yeah, always the apex or anywhere near the apex is fine. So this is a plugged axillary sweat gland. This is an armpit sweat gland. And the reason I'm showing this is from mdhealth.com. I took this picture. I have a patient. She was 16 or 17 at the time. I have her case history in the book. And she came in, her mother brought her in, and she had something just like this. She kept getting plugged axillary sweat glands, and they were getting infected. And her doctor was surgically removing them one by one. And her mother thought, there has to be a better way, so she took her to me, and I bled her ear apex. And the next morning, this thing was gone. And a few months later, she came in with same thing in the other armpit, and I bled that, and that was gone. And I think I had to redo one of them, and it's been years now, and she hasn't come back. She hasn't had that problem again. Okay, trigger finger. No, I haven't had success doing it for trigger finger, Bonnie. Okay, so any strange problems of the head or neck? I mentioned trigeminal neuralgia, dental pain, TMJ, and again, upper limb problems, especially when they're nerve related. If somebody says, "Whoops, sorry," gotta turn this up. All right. So upper limb problems too, especially nerve related. Anything upper limb problems, anything including sciatica, upper limb problems, think bloodletting. So for bleeding the ears, this is what I like to use. I use different instruments for different parts of the body. For bleeding the ears, I like these 21 gauge lancets. You won't find them in a drugstore. You'll have to order them online. To me, they're just perfect. For bleeding the back, I'll talk about it later, I use 17 gauge safety lancets, and you can use those for the ear as well. To me, they work a little too well. Like I said, I'm very busy, and I don't want to have to spend a lot of time stopping the flow of blood. So sometimes those 17 gauge needles, I'll have to stand there with a gauze or Q-tip on it for several minutes to stop the flow of blood. It's not a problem. That's not gonna hurt them, but it's just a matter of time. Okay, let's see. Lipoma type fat accumulations in local spot. I have not bled lipomas directly. When do you choose ear back over ear apex? I always do ear apex. If you see a vein in the back of the ear, you can do that too as an alternative. They all seem to work. I haven't really found that I bleed one part of the ear and it doesn't work, and then I bleed another part and it does work. Bleed the ear apex, and if it's going to work, it seems to work. All right, so let's talk about positioning the patient. This is a safety issue. So it's unusual that a patient will faint or even feel fainty from bleeding just their ear. You're just getting a drop of blood. But there is such a thing as vasovagal syncope, and some people do get it. And even if they're not nervous, it did happen to me once that a patient who was not at all nervous, she was, she had been a patient and she was fine, and I bled her ear, and she was sitting on a stool, which is how I used to do it. And she said, "Oh, I feel like I'm going to faint." And then before I could do anything, she did faint, and she ended up on the floor. And she wasn't hurt, and we were both lucky that time. But I still sometimes bleed people on a stool because it's very convenient. If I'm going to bleed both sides, I can just do one and tell them to swivel 180 degrees and do the other. But I quiz them first, and I ask them, okay, when you give blood, or if you get if they take blood for a blood test, do you ever feel fainty or lightheaded? And if they look at me like I'm crazy and say, "No, I never felt lightheaded," why? Well, then I figure it's okay to bleed them on a stool. If they hesitate and they say, "Well, maybe if they took a lot of blood, I got a little lightheaded," If they do that, then I have them lie down. I'm not going to take a chance. All right, let's see. Do you bleed stagnated veins in the popliteal fossa? Where do you bleed on the legs? We're going to get to the legs. Okay, so hang on. All right. So I have, yeah, in that case, I have them lie down or seated in a stable position. Okay, so these are the Master Dong points for the ears. There's 99.081, 2, and 3. Wei Chia Young recommends bleeding any 2 of those, well, the top always, and then either 2 or 3. Like I said, most of the time I'll just bleed the apex or somewhere. If I'm bleeding something, if it's something where it's important, and like they're really suffering from trigeminal neuralgia, and I want to make sure I get maximum effect, I'll usually bleed a few. I'll bleed the top, and then maybe here and maybe here. I have an ALS patient right now, and he has a terrible pain. I don't know what the cause is exactly, but something with his right neck and shoulder, and he gets great relief when I bleed. He comes twice a week, and I bleed his ear every time, his right ear. And I bleed a few spots, different spots, and each time he gets relief, and it lasts for 2 or 3 days. Okay. All right, so bleeding legs, here we go. So when you bleed legs, you are bleeding veins. Your eyes are your guide. You're bleeding what you see. No cupping is necessary because you bleed a vein, you prick a vein, that vein will bleed. You don't need a cup to pull out blood. All right, so which veins are safe to bleed? Most veins are safe to bleed. The exceptions are, those varicose veins. Now, when I say varicose veins, some people think varicose veins means, spider veins, the purple veins. No, those aren't varicose veins. Varicose veins are those, I'll show you some pictures later, but they're the big green, ropey, bulging varicose veins, protruding veins. You don't bleed those. You don't bleed those for several reasons. Those are we actually just had a question about that this morning on the bloodletting group on Facebook. You don't bleed those because you'll get more blood than it doesn't do any good. It's those veins are the end result of the blood stasis disease process. They're not part of the causal chain. So you're not going to get any result by bleeding them. And in fact, it can just make the problem worse. You can actually just make those veins more swollen and painful. So you don't bleed those. But you treat them by bleeding the flat veins, any flat, dark spider veins. You bleed those, and the ropey varicose veins will respond. They'll get smaller, and they'll feel much better. All of my varicose vein patients immediately say, oh, it feels so much lighter. All right, so these are varicose veins. You see these ropey, bulging veins here? These are varicose veins. You do not bleed those directly. And some style of Japanese acupuncture is suggested to primarily bleed the smallest spider veins. Is your experience different? No, I mean, that's the way I've moved, actually, in the 9 years or so that I've been doing bloodletting. I started out being more aggressive, and then I realized as I went along that it's just as effective to bleed the smaller veins, and it's so much easier. It's easier on you. It's easier on the patient. There's no bruising. There's no discomfort. Okay. Yes, thank you, Lorraine. Chinese medicine bloodletting. So it's on Facebook, and if you're not on it, please look it up and join. So, I mean, lots of great discussion. People post pictures of veins on legs, and it's been there for a year and a half or so, and a lot of good information, a lot of good discussion. Please do join if you're not a member. Okay, so you see these protruding veins. Don't bleed these. These aren't varicose veins, but it's better not to bleed protruding veins. They can swell and they can bruise. Okay, these are good to bleed. I mean, they look like they're protruding a slight amount, but that's only because they're right at the surface. I mean, there's a thin membrane of skin between you and the blood. So all you have to do is go in a 0.5 millimeter or so, and the blood will come out. There will never be any bruising with veins like these. There will not be any discomfort. And they're dark. Dark is the color of blood stasis. You want to bleed dark veins like that. Okay, these are great veins to bleed. Dark, flat veins, perfect for bleeding. If you find veins like this on the leg of somebody who has varicose veins, for example, you bleed these, I guarantee you they'll feel better. All right, so here's a good picture of a leg with both. Down here you see varicose veins. You do not want to bleed these. You do want to bleed these flat, dark veins up here. That will treat these. Dark but not red. I mean, a little reddish is okay. Sometimes they're reddish. Okay. So when I bleed veins, I really like to, it's hard to do it with safety lancets. Safety lancets are those spring-loaded things. Let me see if I have some here. So these are safety lancets right here. I have a picture of them too. We use those for bleeding the back, but you can't aim them precisely enough to hit those small spider veins. So I actually like the 20 gauge, 1.5 inch ones are my favorite. You have to check with your board. They haven't really written their regulations with bloodletting in mind, so some places, like I know the California board specifically disallows the use of hypodermic needles, unfortunately. But if you're able to use hypodermic needles, these are, in my opinion, the best tool to use for bleeding veins, like veins in the leg. And what is the best position for bleeding legs? Well, the Chinese, if you see a video of Chinese practitioners bleeding, you'll see them have the patient standing most of the time, maybe sitting, but certainly to bleed UB40, they'll have them standing. And you do get a good amount of blood that way. You have gravity helping you. But again, I don't think that that's a good idea. I do not bleed patients standing up for exactly the reason that I don't bleed some patients' ears sitting on a stool. They can faint and they can really get hurt. The cleanup is so much easier if you just have them lying down. You put a doggy pee pad under them. You bleed. You can clean it up easily. You may get a little less blood than if they were standing. It doesn't matter. It doesn't make it any less effective. There's no risk of the patient fainting and falling. I strongly recommend having the patient lie down in order to bleed, if you're going to bleed their legs. Okay, I got this from the book Advanced Tung-style Acupuncture by James Marr. These are the Master Tung areas to bleed. They're good to know, but honestly, they're suggestive, but they're not that important in my humble opinion. You see here's the mouth tooth region, so here's the temporal region, here's the stomach region. So if a patient has painful abdominal cramps, you might first look to the stomach region for veins, and if they have, purple spider veins there, then bingo, bleed them. The patient will probably feel better right away. But if the patient doesn't have any spider veins right there, but does have spider veins, say up here, bleed what you see. The body knows where you should bleed, and the body is telling you with those spider veins. That's blood stasis. I mean, my theory is that the body creates those veins as a workaround for blood stasis. And also it gives you, the practitioner, access to the blood stasis. So bleed what you see. Okay, so I'm going to, in just a moment, I'm going to ask Sam to play video 6. That's of a patient named Helen. Let me tell you quickly the story of Helen. I just bled her. This video was made about a week ago. Donna had the great idea of telling me to set up a tripod in my clinic. I don't have anybody there to film, but I set up the tripod. People were very nice and let me film them, and I got some good videos. So Helen is a 77-year-old woman. She came in several years ago with high blood pressure. Her doctor was telling her she needed to go on medication. She really didn't want to. So she really didn't want to, so she came for acupuncture. And the first thing I did was I bled. She had, at 77, not surprisingly, she had great spider veins in her lower legs, and I bled those, and her blood pressure was much better. And she also came back a week later and she said, now my blood pressure is much better, but I had a varicose vein on this leg. Did what you do, and it's gone now, did your treatment have anything to do with that? And I said, well, yes, absolutely. It had something to do with that. So she comes in once a month. She's come in once a month, faithfully, the last Friday of every month for the last several years. So yeah, why don't you go ahead, Sam, and roll that video 6. Okay, so that's Helen's leg. I think I don't have any sound in this. So that's all right. And you can see just very gentle, very superficial. You can see the blood is very dark, which is a sign that it needed to be bled. I'm changing needles. I change needles between every poke, and there are several reasons for that. One is it's called for by clean needle technique. Just as important, you'll see, I think I don't have the microscopic picture, but there you go. I'm just looking for something very superficial, very dark, very tiny. There it is. I stretch the skin, and boom. Doesn't take much blood. And every time I do this, she also has an ankle problem, and her ankle feels better. Her varicose veins feel better. I do this once a month, and every month she comes in and shows me her blood pressure chart. She takes it every day, and it's really good. So here you go again. Find it. Boom. And I think there's one more. This is the other leg, by the way. All right, I missed that time, so I'm stretching it, stretching the skin. There you go. By stretching the skin, it goes in, that needle will go in like butter. If the skin is too loose, you hit it, it'll just it'll hurt because it'll press it in. But if you stretch that skin, the needle will go in very easily. So anyway, yeah, I change the needle each time because the clean needle technique manual calls for it. And by the way, bloodletting is in the clean needle technique manual. If anybody questions whether bloodletting is in our scope of practice, you can just point to the fact that, yeah, it's in our scope of practice. There's a whole section on bloodletting in the latest edition of the clean needle technique manual. And the third reason that you want to get rid of that needle is that if you're using a hypodermic needle or a piercing needle, those are hollow needles. And as soon as you prick somebody, the barrel of that needle is full of blood. Accidental needle sticks happen, unfortunately. So you want to get rid of that thing as soon as you can. That's a hot potato. Once you prick somebody and that barrel is full of blood, you want it out of your hands. All right, so bleeding veins in legs is great for any nerve pain radiating down the legs, such as sciatica. So many things: abdominal pain, plantar fasciitis, and when it works, it's a miracle. I mean, it's really quick. Peripheral neuropathy, hemorrhoids, coccyx pain, really tough things like this, high blood pressure, and so much more. The thing that if it's a blood stasis problem, which it often is, the thing that's really going to break through is is bloodletting. All right. Okay, what gauge needle was that? That was a 20 gauge needle. Are the hypodermic needles less painful than filiform needles or lancets? I think they are. I mean, filiform needles are very thin. You can't compare a filiform needle with a hypodermic needle, but they're super sharp, those hypodermic needles. Isn't the blood dark because you're bleeding veins? Blood in veins is dark. No, not necessarily. Sometimes you'll bleed a vein and it comes out very red. And I know because I'm looking for how dark the blood is. And if the blood comes out very red, I'm disappointed because it looks like there was no blood stasis. Okay. So bleeding the back. That's the third area to bleed. Okay, Master Tung had a very sophisticated, very highly developed system of bleeding the back. Unlike any other system that I know, the points are labeled DT, which stands for dorsal trunk 1 to dorsal trunk 17. And all of the Master Tung back points are bled, not needled. Part of the reason may be that he did deep needling, and he probably knew that deep needling in the back is probably not such a good idea. But also there are points on the back that are perfect for bleeding. And again, they're areas. They're not really points. Don't think in terms of point. The exact point that you bleed when you're bleeding the back is determined by palpation. All right, so let's compare for a moment bleeding legs versus bleeding the back. When you bleed legs, you're bleeding veins. You don't cup. I mean, you saw what happens when you poke a vein. It bleeds plenty. You don't need to cup it. On the back, there are usually no visible veins. Sometimes older people, obese people, you'll see visible veins, but mostly on backs, you see hair and maybe a pimple, but you don't see many veins. To find the exact spot to bleed, you need to palpate. And you're using a lancet. This is capillary bleeding. You're just pricking the skin. And not much blood is going to come out, barely a drop if you don't cup. So you really need to cup to draw out a decent amount of blood. All right, so there's a back. In case anybody forgot what a back looks like, you can see that there are no veins there, no visible veins. That's typically what you see when somebody takes off their shirt and they lie face down. And here again is my favorite tool for bleeding the back. It's a 17 gauge safety lancet. In North America, it's sold under the McKesson brand. Elsewhere in the world, it's sold under a different name. It's sold under the name ACTI Lance, ACTI-Lance, L-A-N-C-E. And it's 17 gauge. It's a safety lancet. It's spring operated. So, you take off that. Let's see, I'll demonstrate. So here's one. You twist this, take it off, and then you put it against the person's back, push the button, and it goes doink. So the blade just came out, went in. Now it'll never activate again. See, I can push it. It's done. It's made at the factory to activate one time. That's why it's a safety lancet. There can never be any cross-contamination, never any accidental needle sticks with a dirty needle. Harm Breedveld, what do you mean by palpating? Painful points. Yes, you press with your thumb. And this is the best thing. So I use 4 or 5 of those within the diameter of a cup, and then I cup. All right, and I like to use single-use disposable cups. You can use glass cups, but you have to sterilize them. They've been touched by blood, and that's a lot of time, and I don't have enough time to do that. So single-use disposable cups, you don't need to sterilize. You use it, you throw it out. It's 25 cents a cup. You sleep at night. It's well worth it. All right, so let's talk about Dong Point DTO7. I don't have time in this brief 1-hour webinar to go into the many back points, but let's talk about the one I use the most, which is DTO7, which treats the worst knee pains. Again, it's an area, not a point. But patients who come in with bone-on-bone pain in their knees, degenerative arthritic knee pain, and they're told that they have to get a knee replacement. Sometimes this will work a miracle. Often it'll work a miracle. So this is from Wei-Chia Young's book, Dong's Acupuncture Point Study. And originally DTO7 was described as a 3-point unit. But really I find that it makes more sense to see it as an area. This is really the DTO7 area. If you palpate within this area, if this is going to work, you will find a point that makes the patient jump. And you will be pressing and pressing, and they'll say, no, no, no. And they'll go, oh! And then you know that that's going to work. And let's say this person has right knee pain, and you press, and they groan, and they jump, and they flinch. And then you try the mirror image on the left side, and they don't have left knee pain. And if that doesn't produce any pain, that's further confirmation that this is going to work. Okay, so how do you do it? Well, you palpate within that area for a really tender point. And when you find it, if the patient really flinches and groans, then you know you found it. You use 4 or 5 of those McKesson safety lancets, and then you put a cup over it. And you try to pull out some blood. And so I have one more video I'm going to show you, and that's of me bleeding that point, Dong Point DTO7. So go ahead, Sam. Why don't you go ahead and roll it? Okay, so let's find the worst spot, okay? The one single worst spot. Right there? Okay. I like that certainty. I don't like to start until I get that sense of certainty, not like around there, but yeah, right there. Okay, tell me if I find another one that's about that good or that bad. Tell me if there are any more. Tell me if there are any more. And we'll do another one right here in the middle of all of those. So you can see how little blood comes out. That's why you need a cup for this type of bleeding. You see when you with some suction, a little bit more blood comes out. Okay, so we can take this. So you want to take a pretty thick wad, put it around, release the pressure or the suction. Get some blood in there. Okay. So we're using a machine. I'm using a hand pump to get suction in the cup. Was that real time under 30 seconds that you kept the cup on? I think that was real time. It doesn't take long. I don't leave it on for very long. I wouldn't leave it on for more than 2 minutes. And in that case, however long it was on was long enough. Okay, so favorite conditions to treat with bloodletting. I see we're almost out of time. I prepared probably more stuff than I would have time for, but let's go over a little bit more. Okay, so first of all, to bleed or not to bleed, there's some, how do you decide if you're going to bleed or not? Well, some conditions respond so well to bloodletting and so consistently that bleeding is almost always the first thing I do. Here are some of my favorite things to bleed for. All right, nausea. So these are the 7 points that Master Tung specified. Really, you can forget about the bottom 6. All you really need is this top one. And you just pinch it up, take a McKesson safety lancet, boom, once or twice, click, click, squeeze out a drop of blood. You can't really cup there because of the hair, but squeeze out a few drops of blood, and they will instantly say, my nausea is so much better. Is that possible? Is that possible that it could be so fast? It is. It's one of the most amazing treatments in all of Chinese medicine, I think, and pretty much 100% effective. Okay, Jessica Bratland, do you have to worry about cross-contamination with the hand pump? Jessica, that is such a perfect, such a wonderful question. The answer is yes. So what I do is I take a plastic bag. This is one of the plastic bags. I always put the pump in a plastic bag, and I handle the pump through the plastic bag so that I won't get any blood on it. I didn't really have time to go into that. I'll go into all those considerations on Sunday. But yes. It's something you have to do. Let's see. Nausea for morning sickness, you can do it. Of course, everybody's afraid of what they do with pregnant women because there's so much liability. But I've done it on pregnant women. Let's see. All right, let's see. So knee pain, we talked about knee pain, degenerative knee pain, trigeminal neuralgia, sciatica. I mean, if somebody comes in with back pain, my first question is it going down your leg? Does the pain go down your leg? And if they say no, then I put bloodletting on the back burner. But if they say yes, then the first thing I do is bleed them. I have them lie down. There's an area on the upper back that you palpate. It's near the DTO7 area that you can wet cup for sciatica, and also, of course, bleeding the leg directly, usually in the UB40 area. Okay, so this is the sciatica area. DTO8 is up here, DTO9 is down here. I combine them into one area. Okay, let's see. Do you bleed flat green veins or is it just spider veins? If there are flat green veins and spider veins, I'll bleed spider veins. Sometimes all you get is flat green veins. Sometimes all you get is veins that are so faint, you're not even sure if they're really there or not. So, if that's all you've got, then that's what you bleed. All right. And again, you're bleeding veins in the legs. Lancets are really not adequate for that. You really need a better needle like a hypodermic needle. Here's a hypodermic needle. This is I think this is a 18 gauge. And here's a picture of me bleeding somebody, a woman with interstitial cystitis. And you can see the blood is very dark. And it has been very effective for her interstitial cystitis, one of the few things that helps her. High blood pressure. Oh my God. I mean, doesn't always work, but it often does. And in a rational world, before any doctor prescribed blood pressure medications, they would bleed for this because very often that's all they need. Was it UB40 for IC? Yes, and I also bleed her. Sometimes I have her lie on her back and I bleed, stomach 36 area. All right, so high blood pressure. Varicose veins we talked about. Don't bleed varicose veins directly. Don't bleed those varicose veins directly. We saw this. Hemorrhoids. Works great for hemorrhoids. Bleed the UB40 area or wherever you see veins on the leg. Eye problems, abdominal pain, reflux sometimes. And, okay, I'll tell you about Charles' spinal cord injury and then we'll finish up. Charles is a paraplegic. He had a motorcycle accident 4 years ago. He's in a wheelchair. His spine isn't actually severed, but he has no activity below, I think, T11 or T12. And he came in, he was in so much pain, terrible pain, and it's been 4 years. Nothing really gave him relief. And I had him lie down. I palpated along his spinal cord, especially on one side, towards the bottom of the scar. It was very tender. And a few appointments, I wet cupped him in 4 spots, 3 on the right side, 1 on the left side. And he got incredible relief. And then he stopped coming, and he came in, I don't know, a few months ago. He came in with his new dog. He just dropped by. He's incredibly independent. He's in a wheelchair, but he does everything by himself. And he came by with his dog, and he said, I just wanted to tell you that I've been feeling great. I just wanted to thank you and tell you that the reason you haven't seen me is because I really don't need your services anymore. I've been feeling so good. So, all right, Donna, what do you think? It's 5 o'clock. Shall we wrap up? All right. In the meantime, if anybody wants to, I think Donna's coming on. There you are.
Okay. Okay. All right, Dean, to answer your question, you were great. Thank you so much, and thank you everyone for joining us. We had a ton of questions. They were great. If you don't have an eLotus account, please sign up for one. You can go to elotus.org and sign up for a free eLotus account, and all new accounts you will get an email with a 1 CEU coupon code that you can choose whichever 1 CEU course that you like for free as our gift to you. So again, please, if you don't have an account, sign up at elotus.org. That way you get a coupon code for a free 1 CEU course of your choice. So you can choose a video or an article, actually. Other than that, we hope to see you guys at Dean's Full Day class, which will be this Sunday. It'll be 9 a.m. to 6 p.m. Pacific time. We have it available as an online webinar from 9 to 6 p.m. Lunch is 1 to 2 p.m. Or you can come in person. We have just a couple seats left. So you can sign up for both of those online. And that's it for today, everyone. Thank you so much. And we hope you enjoyed the class. And hopefully we'll see you on Sunday. Bye.